what I'm going to share with you over the next few minutes, how many of you have employees? Put them up if you have employees. Okay, good. About 70, 80% of you. How many of you know big employers? Just curious. Put them up high. Okay, great. Okay, well, this is going to be really eye-opening and very profitable for you. So I'm going to introduce you to a dear friend of mine, Chris Gaddis, who is doing something incredible that basically, well, actually, I'll kind of share this with you. Chris, you don't mind if I tell them a little bit about this? So Chris and his partner have created a program where they utilize some tax codes under the Affordable Care Act, which when they do, it creates a $500 to $800 annual FICA tax deduction per employee back to the employer. It creates a net increase in pay to the employees, so that all the employees get raises. And they get some valuable health benefits on top of whatever they may or may not currently have. It doesn't disrupt anything that's currently in place. And there's no net cost to the employee, and there's no net cost to the employer. Is that crazy? How many of you knew anything about this? Yeah, no. Okay, please welcome Chris Gaddis. Chris, come on up here, buddy. Come on up here. All right, amigo. This is for you.
After that introduction, I don't know what else I got to tell them.
Exactly.
We're probably ready to go here.
Mic drop.
Thank you, Daven. Great to be here. I couldn't attend last year, and some of you probably met Jeremiah Demery last year, who represented Capstone and kind of started that off for us. We've had a great year since then. I've known him. He purchased one of my marketing companies earlier to work with him for many years. So we had dinner last night. And one of the last things he said to me was, "Don't be boring today." So I
You're never boring, my man. Never.
Well, then, as I'm about to get up here, the last thing my wife says to me is, "Don't be boring."
Oh, my God.
I don't know what I'm doing, but hopefully I can give you something interesting. I'm going to try to cut this down a little bit, too, to get us back on track time-wise. So I'm going to stay high level. I'd love to talk with you guys. We've got a long cruise here about the program and specifics for those of you who this can work for. So let's jump right in. I want to talk. I'm gonna start here. So the Affordable Care Act. This is where this all started. Enacted in 2010. Let's talk about the current state of health in America. I heard a laugh. Chronic disease. Chronic disease. 40% of Americans, 133 million Americans, suffer with chronic disease. 60% of adults, so 6 in 10 adults, and 27% have 2 or more chronic diseases they're dealing with. These are medications, maintenance medications that we're on, right? We're in an aging, unhealthy population in general. And so one of the biggest things, I'm going to skip to the biggest pushback I get when I talk about this program with employers, is it sounds too good to be true. And when we actually know where it comes from, the Affordable Care Act, and why it started here, it makes a lot more sense. So knowing what we know about healthcare, chronic disease, all of those things, we see on page 509, employer-based wellness programs. And this was in order to expand utilization of evidence-based prevention and health promotion in the workplace. Wellness plans have been around for a long time. It's nothing new, but they wanted to expand it. And the idea was, instead of me coming to each one of you individually talking about wellness, I can go to one employer, hundreds or thousands of employees, and affect all those lives in one try. And that's what Capstone does. That's why we're here today. And that's the spirit of this law that we try to live by. And so what I want to spend a little more time on today is how we're actually doing that. And this is new. We rushed to get this out. We've officially launched the new offering April 1st. But I'm going to be sharing that with you today, so I'm excited about that. Actually, let me mention one more thing here. I've had the fortune of talking to some senators and others who are involved in this. And one of the things they explained in this too good to be true theme was the government incentivizes us through tax dollars, right? In many different ways. Puerto Rico, right? That's an example, moving to Puerto Rico. We saw that during the CARES Act, during COVID. Everyone was getting checks and different things. This was no different. The idea that we can invest $1 today in employees, and that hopefully leads to $2 or $3 in return, because the one thing that is going to happen to all of us is we're going to age, and we're going to turn 65. And at age 65, we go on Medicare. No longer private insurance, we're on Medicare, which is socially funded, right, through taxpayer dollars. It's a social program that's in a bit of trouble. There's concerns about that. So if we take $1 today and return $2 or $3 in the future, that's the idea. And for a long time, we were kind of fighting with one arm tied behind our back because the IRS was not being helpful. All right, because in our country we have the government that sets legislation, right? Those three branches of government, and then the IRS, which only enforces taxation. And people had a hard time separating those two things. And so what we talk about is actually separating that from the law versus the taxation. And the IRS in April of last year finally came out with regulations around these programs that showed not only is this a legal program, but how to operate. And that it's, there's some different things in here we'll talk about another time, but this is what gave us kind of the wind behind our sails coming out of this cruise, talking to a lot of you. I know some of you already heard about this, and all the things that happen afterwards. So the three big takeaways: no net cost to employees or employers. And I've been talking to employers about this, and I was talking to a private equity-backed company. They work with 2,100 hospitals. They're looking for programs for their hospitals, and he kept beating me up on the ROI. Like, what's the ROI? What's the ROI? And I finally said to him, how can I give you an ROI when it doesn't cost anything? Let's talk about ROS, return of savings. And it clicked with him. He's like, wait, we don't pay anything, and we make money. And it was from there, and then he stole it from me, but we've talked about that. Preventative health. We're here for preventative health. So I'm going to go through our offering real quick. And we're not here to disrupt any benefits. That's the other thing. We're not here to change medical plans, anything else that the employer is using or has with their employees. And so it can go off cycle from renewals. If you're renewing your plan on the first of the year, we can put this in at any time, and it does complement the major medical very well. All right, I'm going to jump through here. So we partner with an app called Elucian, and this is what I'm excited to share. This is new. To this point, frankly, in version 1, we hadn't done a good job of addressing wellness and helping employees really engage in wellness. Excuse me. This app goes to change that. So it's one app, one login. You can get on your computer, on your phone. It goes through Alexa as well. And everything is built into this app. So it's one app that they have. Now you're going to see a lot of really cool features. Number 1, biometric facial scanner. This is great technology. This allows for people to get advice, help outside of a brick and mortar physician, going to a doctor. All right, driving the 15, 20, 30 minutes through traffic, sitting in the waiting room, getting moved into the room, waiting, seeing a doctor for 10 minutes, and then doing the whole thing going back. Pulse rate, heart rate, breathing rate, even body mass index can be calculated from just scanning your face with this app. Personalized employee dashboard, health assessments to get a baseline of health and wellness. Customized daily wellness where you can watch goals, you can track, you can sync your wearables, your watches as well. There's hundreds of on-demand health literacy videos, even financial literacy, which is huge for employers as well. And you can compete in challenges, so there's a community aspect as well that pulls in people that are all using this app to be a community to help with weight loss and all those different topics. Complete fitness and nutrition library. Customizable plans, anytime, anywhere, yoga, stretching, weightlifting, food, nutrition, recipes, and that's all customizable. And then AI-driven lab tracking. So everyone that gets in the program gets a free lab test that's outside of a doctor, so they can just go to a lab and get that test for free. Populates in here. Even if they're going to a doctor, they can just upload that file, and AI will read it and fill in all these things. So they can get a tracking of everything that's happening every time they take a test, and they can start to see trends when they're working with their physician or on their own wellness. We've got other great benefits. This is all for employees. They're all getting access to this. So we're really helping with employers that are having trouble with employees that are getting to work, dealing with sick children, all of those different items, because we are also putting in an incentive program. So every time they're doing these activities, they're earning points, health literacy points, and they're able to redeem them for gift cards. So this is, again, that engagement aspect. We've partnered with Cirrus MD to provide telehealth, instant access to care. They are the telehealth provider for the Veterans Administration, so the VA hospital. They do urgent care through here, chronic care, women's health, mental health, behavioral health, and then other health questions. So it starts with text. 83% of their conversations are resolved with text. You can do video chat as well. And this is for the whole family, not just the employee either. So the whole family is getting access. We are now over 1,000 prescriptions for free. These are prescriptions that the family, again, can have access to. This is blood pressure, infection, headache, sickness, women's health, also comprehensive diabetes program. These are all included in this program at no additional cost outside of it. And then a new partnership with Life Guides. Mental health is one of the biggest issues in our country outside of chronic illness, right? Those are two hand in hand right now that are getting a lot of time in discussing it. It's also a significant issue in that there's not enough qualified people to provide it. And it's so complicated and so hard to deal with insurance companies that most of them just do cash because they're in such demand. And it's not cheap for the people that really need it. Life Guides is peer-to-peer counseling. They're trained. For people that need additional help and true psychiatric care, they can refer that. But 12 different topics of people that have gone through the same thing that these people have gone through, whether it's coping with illness, even just things work, life, and leadership. They want to improve their standing at their job, get promotion, what they can do to work towards those things. Unlimited visits as well. And we can't forget about our pets. Go Lexi, new partnership, a virtual pet doctor. So you can jump on a call, just walking into a veterinarian, $50, $100 in copays, just walking in. Now you can have a free consultation about what's going on. Remember, I had a dog who swallowed a whole rib bone, and I was terrified. It was like 11 at night. We're trying to figure out what's going on. If I had a pet vet I could have called, it would have helped a lot. Now, we also have an indemnity benefit. And this is one of the things that makes us unique and allows us to put this program in without having to worry about if they have health insurance, if they have other things. This is a standalone benefit. Now, this is also why you need a life insurance, health and life insurance license to sell this product. But the great news is you do not need it to get paid on this product. Okay, so you can be a referrer, can't sell it, but you can refer. So that's what we're here. We're here to create referral partners as well. So these are 6 different plans that create savings. Again, I don't want to go over the specifics because I'm sure there's going to be a lot of questions. But I'm happy to, on the cruise here or afterwards, schedule Zoom. We got a great team that can also educate you on this. But they get benefits around inpatient, outpatient, daily hospital benefits, emergency room, and ambulance services. I'm going to run through the highlight of the numbers again. So Daven shared at a high level that employees get an increased take-home pay. In this example, about $85, we see an average of about $100 per employee per month. These are dollars they can use for anything. It represents, in general, 2 to 3% raise for the employee. That's a big number for many people. I forgot the statistic, like 60% of Americans don't even have $500 in savings to deal with an emergency. So this starts to help in those ways as well. Now, the way it happens is we use Section 125, which has been around, it's been enacted since 1978 to create pre-tax premiums that reduce taxes. And that's how we're able to get the savings. And then the employer saves. The employer saves on average $60 per employee per month. We charge a $40 admin fee, and this is how we're able to pay referrers, because it's an admin fee, not a commission on an insurance product. So that's important. So where's Bruce? Bruce, you here? Where is he?
Yeah, here's Bruce.
Oh, right there. Yeah. There he is. So he's going to be our partner here on the cruise, too. So I want to bring him up, just introduce him real quick. It's Bruce. We had a good 2-hour conversation the other night by the pool. So Bruce, I got a form, too, you guys can fill out. But Bruce can be on the cruise as well. Anyone sees him walking around, be happy to have a conversation about the program as well. He's one of my dearest friends of about 15 years. Bruce Mack. Give him a round. Yeah, love Bruce. Thanks, Bruce. All right. And so, with an average savings of $723 per employee per year, if you've got an employer that has 1,000 employees, $700,000 added to their bottom line. So when you start to add up all these selling points, it's a very easy conversation to get. I've talked to some of the largest companies in the world. We were able to get indoors that I wouldn't be able to get into prior. I'll share more about my story, but I've been trying to get with business owners. That's been my business for the last 20 years. And this is the easiest way I've found to get in, and you'll have the other opportunity to cross all other products that you're looking to bring in as well. So here's an example of a pro forma. A group out of New York, 3,000 employees, paying bi-weekly, $63,000 average salary. You can see here that 93% qualification, so 2,700 employees, $1.7 million in savings. It's very easy. This is a quick quote that we have. We just need those 4 pieces of information up there in the yellow, and we can deliver a quick quote to an employer within a couple minutes and have this conversation. And you can start doing your own math here. Now, the other thing I should mention is referral fees. So those of you who are bringing companies or opportunities to us as well, there's a $10 per month per employee referral fee. All right, Dave was talking about recurring passive income. I mean, you got some great strategies, but this is another one that's very easy, right? To be able to bring that in and just refer a business with your relationship. 2,700 employees, that's 27 grand a month, recurring revenue every month. All right, so I'm gonna finish up here, try to get us back on track. I think we're just close to that. So I'd love to connect with you. So grab that QR code. There's a little, up in the right-hand corner, there's 3 dots. They'll pull up this thing in the bottom and just download contact a phone. Just going over this real quick. So my email, phone number, my WhatsApp, if we're on the cruise, you guys want to catch up or meet, just shoot me a message. There's a Capstone Cruise interest form that we set up just for this. If you want to fill that out, we'll send you information and follow up with you. You can tell us if you want to be a referral partner, if you have a business of your own. We'd love to work with you. I have other interests as well, other companies that we own or are a part of that are on there, so I'd love to talk about any of them. But Daven, I'll turn it back over. Hopefully get a
wonderful.
Time back
Chris
here.
Gaddis. Thanks, amigo. Great job.